it's a crisis and an attempt, at least now, by Brussels to do some crisis management after having been largely sidelined until now.
Okay, and Melinda, let's talk just about Germany and its place in the EU. Germany has a huge budget surplus right now and has often been criticized for its fiscal policies, which have ensured that it has this.
jamono yu nekkee foofu yëpp man ak yow maa ngi am benn waay maa ngi ko yónnee xaalis bu bari pour mu sampal ma suma kër te ba léegi tabax bi àggut fenn te yow nga waxoon ma ne ma bi nga starté samp yàggul léegi nga toll fii foo jaar
li waral loolu nag mooy dama ànd ak waa Baluwo
kon su ma la déggee Baluwo dañuy yëngu ci samp kër tamit
ni ngay def nag yomb na da ngay log on to www.baluwo.com mun ngaa jënd ci ñoom ciment suuf banta weñ ba ci daaj yi nga xam ne di nga ko soxla lépp lu jëm ci wàllu samp rek mun nga koo am ci lu yomba ak Baluwo daal yaay dugal sa xaalis fi nga ko bëgga amee ko ci ni nga ko bëggee.
Hello viewers, this is Africa TV. Welcome to this special edition on the coronavirus pandemic discussion as the President of the Republic of the Gambia, President Adama Barrow, is to address the nation on the country's preparedness to deal with COVID-19 pandemic. So of course we are here to discuss about that as the President, like I said, is about to give a state address on the pandemic. And of course, joining me on the platform to discuss and look forward to the President's statement is, of course, Ibrahim Abba, Africa Senator, Senior Editor. Ibrahim, good evening and welcome to the program.
Thank you very much. It's my pleasure being here with you.
All right. Thank you. Thank you very much. And on my left, I have Nyawuru Koma, Regional Youth President for KMC, and of course for the UDP, United Democratic Party. Nyawuru, good evening and welcome to the program.
Good evening, gentlemen. I'm very delighted to be here today to discuss this pertinent issue that is COVID-19. As you said, would be very glad after hearing what the President has to say to the country.
Yeah.
And we do a critical analysis of what we think should be done and should be said.
All right. Thank you very much. And like you said, of course, we would be having, of course, a discussion on what the President would, of course, going to deliver or talk about on his statement in any minutes from now. We were, of course, told that the President would, of course, give a state address on, of course, 8:45 local time. All right, that is, of course, 1845 GMT, I should say. So we are talking about coronavirus or COVID-19, the pandemic. It has a great impact on the global world since its emergence in China. But it's good to say no case is confirmed yet in the Gambia, despite more than 20 cases have been confirmed in neighboring Senegal. Prince, quickly, before we, of course, we hear from the President, coronavirus has been a big talking issue, and of course the world has been grappled with a big issue since its you know, emergence in China. What is your own assessment so far on the impact of it had globally?
As you said, Amadou, it is just about 3 minutes to the speech of the president.
Exactly.
He will address the nation. Gambia, West Africa, where it is no cases yet confirmed in the country.
Yeah.
So this is interesting because if you look at the situation, although Gambia, there is no case so far, but if you analyze properly, you realize that Senegal, which is our neighboring country, has registered more than 20 cases. So therefore, you know, whatever, you know, the situation in Gambia, it is something of public interest right now.
Indeed.
So President Barrow, this will be his first time to talk about it since the outbreak in December 2019, and that it is spreading fast across other countries. So what about Gambia today? So the Ministry of Health and Social Welfare has done their part, and actually they've done some press conferences to explain the response mechanisms that are in place in the country. They've been updating, and you know, a free toll number is available for, you know, people to call in. So this time it is the office of the president that is coming to the mic and in a televised statement.
Yeah, exactly. We have just about a minute or so to go. Just quickly, Nyauru, what is your own take on the impact of coronavirus and how Gambians are feeling right now, and as we are to hear from the president any moment from now?
Obviously, the impact of the coronavirus cannot be underestimated at any given time, given the magnitude in which it is discovered and the country from where it comes from. Well-developed country, one of the most powerful countries in the world. If they have an issue like that, it should be a concern for the Gambia. And the Gambia is at a very, vulnerable position when it comes to the corona. Because you can see Gambia is surrounded by Senegal on all three sides except the Atlantic Ocean. So if we have like 28 or 29 cases in Senegal, it is a cause of concern for the Gambia. Because wherever you go, you must pass through Senegal, and wherever you're coming into the country, from not if you are not coming from the seaport or from the airport, you pass through Senegal. So when the restriction is not there, border restriction, people are still getting in and out of Gambia to Senegal. It is a concern for everybody. This is a serious issue, and the government, I think today, will hear something very serious, very drastic when it comes to the contingency.
Just quickly, Nyauru, you know, what exactly are you expecting to hear from the president as we are about to hear from him?
What we expect to hear are the plans of the government, what they're going to do to contain the virus, what are the plans that are already in place for in case there might be cases discovered.
Okay.
What are we going to do
we got to leave it at
combat
that.
those issues?
All right, thank you for now. We got to leave it at that because it's exactly time to hear from the president. Like I mentioned, it was officially said that it is 8:45 local time that the president was going to give a state address on the country's preparedness against or to deal with the coronavirus or COVID-19 pandemic. We can now go with the President of the Republic, President Barrow.
Fellow Gambians, in the wake of the COVID-19 pandemic caused by coronavirus, I commend the Ministry of Health and partners, all frontline health workers and support staff for the efforts made to put together a responsive emergency program. You will recall that on 30th January 2020, The World Health Organization declared coronavirus or the COVID-19 disease a public health emergency of international concern. As a result, my government has since been deeply concerned and through the Ministry of Health began alerting the Gambian public about the global outbreak of coronavirus. We immediately resolved to prevent, contain and manage COVID-19 cases in the country by raising public awareness through the media and orientating health workers along other necessary preventive measures. The Ministry of Health and partners have been working extremely hard over the period to enhance their preparedness against COVID-19. For this purpose, an extraordinary emergency meeting comprising members of the National Health Emergency Committee and senior medical practitioners in various specializations was convened. Another important measure taken has been to strengthen surveillance at the airport and at various points of entry along the Gambian border, among other precautionary actions. Isolation centers and rooms have been prepared also to deal with suspected cases at all major health centers. Fellow Gambians, so far, there is no reported case of any coronavirus infection in the Gambia. However, the government is not complacent. There are surveillance teams at all major entry points into the country, whether by air or land. I have been informed that as at March 2020, a total of 355 people of interest have been followed, some of whom have been put on self-isolation. 149 of them have completed checkups without any symptoms of COVID-19. 206 are still under surveillance. Of the total seen, only 8 required laboratory testing and their results were all negative. I take this opportunity to express my support to all those affected in one way or the other, and to assure you of my government's commitment to preventing any coronavirus infection in the country. Fellow Gambians, on the 11th March 2020, the World Health Organization, WHO, declared COVID-19 a pandemic. Many countries continue to report cases of infection, including our close neighbor, Senegal, which confirmed its first case on 29 February 2020. They now have 24 confirmed cases with evidence of local person-to-person transmission. Making reference to regional and international trends, my government has taken extra precautionary measures to further strengthen the country's ability to prevent any case of COVID-19. It is in this light that all non-essential travels by government officials, including ministers, permanent secretaries, managing directors and directors of all ministries, departments and agents have been suspended. Also, realizing how vulnerable people are during public gatherings, I hereby declare that all public gatherings are suspended henceforth. These suspensions include all international and local conferences, workshops, and seminars to be hosted in the Gambia. All schools, universities, madrasas, and daras or majlis will be closed from Wednesday, 18 March 2020 for 21 days. Furthermore, all other public gatherings in whatever form, including lumos, open markets, and gamos, are immediately suspended for 3 weeks. The suspension period will be subjected to review as we get updates from the experts. As an other preventive measure, all travelers from hotspot countries will be isolated for 14 days upon arrival in the Gambia. To further strengthen our preparedness against coronavirus and COVID-19, I have directed the Minister of Finance to provide funds immediately to prevent any infection. Fellow Gambians, to reiterate the important health messages of preventing, containing, and managing coronavirus, I implore you all to improve on personal hygiene, especially by hand washing, often with soap, covering the mouth with tissue or the elbow, when coughing or sneezing, and social distancing to prevent transmission. All citizens and residents of the Gambia are reminded of the importance of adhering to these preventive measures and avoid handshaking. While my government is closely monitoring the situation, I urge the public to get reliable facts about the pandemic through official public awareness programs. Once again, I assure you of my government's commitment and preparedness to stop any coronavirus infection or transmission in the Gambia. Together, we can achieve this and contribute towards the promotion of good health for all and protecting our country and our people. I thank you for your kind attention.
His Excellency, the President of the Republic of the Gambia, President Adama Barrow, they are speaking on the country's, of course, readiness or preparedness, of course, to counter the deadly coronavirus or COVID-19. Of course, we heard from the President. He have delivered a statement where he mentioned some of the measures the government have taken in making sure that there is a total position of the government to counter the disease. Of course, he mentioned about many issues, and among which, of course, is the public gathering, closing of schools, and open markets, and other ones as well. What is your own take? Or what is your
I must say that this is a remarkable move by the side of the president, and that it was highly anticipated that since the pandemic being reported, the president was yet to make any official statement, especially at this magnitude. So if you look at what he had just commanded, is more of the closure of schools, which is going to take place immediately. That means as of tomorrow, Wednesday, no school from the lower basics to the universities. So he had just ordered the closure of all universities, all schools. So also, in addition, that all public gatherings in all form, whatever form, is being banned for the meantime, and that is going to last for 3 weeks. Although the closure of schools is going to last for 21 days, and which is a big gap, almost a month. What we knew about the president speaking is that the date was set for his address to the nation, but as to what he would actually discuss was never mentioned. So now this is where the surprise comes in.
Was there anything probably you expected to hear from him? And you definitely
one of the most talked about, especially going by social media and then going by reports that we are monitoring for, and then we've been part of the reporting for nearly 1 week of intense reporting. is concerns the border close.
Exactly.
So Gambia and Senegal are more of one country, like the brother said earlier. Exactly. So that is also one of the areas. So actually, now Barrow did not mention anything about it. I think he want to forward
exactly.
the question.
I just want to bring on Nyauru here. Of course, like Chris have said, of course, the president have mentioned several issues of which you heard from him personally, but he did not talk about border closure. What's your own understanding on that? Or what would you tell us, why the president might have,
I'm touching my face, and those are one of the things they are advising people not to do.
Are you scared?
Especially, I would be scared, because every sane guy should be scared because of the trend and the magnitude of the virus. We don't know a lot about this coronavirus.
Indeed.
It is alien to us, and where it emanates from, I tell you, they are a powerhouse like China. So, but what I've said, yes, this speech is so-so, but it lacks a lot also, in the sense that when issues like this happen, it is not about being friend or being one. It's about protecting the sovereignty and the health of your citizens. The first thing that should be said was the borders should be closed, because we are sharing borders with Senegal, and they have confirmed cases. We don't have yet. The most important, it is prudent on the government to close the borders, and not only to say people from the affected countries.
Yeah, he
said that.
Probably that might have been enough for the government as of now, considering that no case is confirmed in Gambia.
We are not saying we have no cases confirmed. Our case is different from other countries.
Yes.
Here, even if we have cases, we need samples to be sent to other countries to actually confirm, because we don't have the ready-made facilities for all this. These are the issues that we should be discussing. The Gambia should have surpassed this with nationhood for 55 years now. We cannot even have a correct testing facility for issues like this. It's pathetic.
Yeah.
This is a pandemic. Every country in the world has, one way or the other, has a facility that it will not go anywhere. All is about to restrict people from going to affected areas.
Yeah, but
it will not be sent abroad. I'm coming.
But I just want to ask this. I know where you're heading to, but then again, I was going to ask, probably you haven't heard what the president have just said. You would agree that this is a strong position from the government to deal with the apparent situation as far as this disease is concerned?
I'm saying to you, you term it as a strong position. It is a position, but it's not that strong.
Oh, really?
Really, in my view, it is not strong. It starts from border screening. You should close the borders. Big European countries like Germany and all the EU countries are quarantining the whole country by closing their borders, because they have people affected in other countries and they don't want the number to escalate. Now we don't even have confirmed cases. Now, like, we should set that perimeter of quarantine so that only people within the country will be confined to the Gambia, will not have in and out, so that we reduce the tendency of transmitting, or at least coming in contact with the coronavirus. And secondly, it is not only confining people from the affected countries to a particular area for 14 days. It's not good enough. Stop all travel from affected countries to this country. People coming from the affected areas to this country, stop it. Because they won't allow anybody coming from this country to those countries. They've taken their stance. This is what the European countries are doing.
Yeah, but
imagine, I'm telling you, and I think the government should not even say non-essential travel for state authorities and things like that. Travel for everybody should be closed. Because you know why?
Yeah.
I'm citing an example. Today, the Polish government, that is Poland, the Polish government, they are on quarantine, the whole cabinet. Because a minister traveled and he just been proved positive with corona. Exactly. You see the severity of the case of corona. Yeah. They have quarantined the whole cabinet. So whether it's essential or non-essential, travel outside the country to affected areas should be out of our list.
But then
people should not be traveling outside.
I understand that you are somewhat concerned about the issue of border closure. Countries like Senegal have did so, and of course maybe understand also Guinea-Bissau as well have given an order by tomorrow. I think countries that are hardly hit by the coronavirus are not allowed to land in their to cross into their borders. But then coming to Gambia case, I want to believe that the government are also closely working with health authorities like the WHO for advances in such situations.
Like I said, I'm still reiterating this. This WHO will give you the expertise and the advice.
Yeah.
But the decisions, the informed decisions that the government is going to make lies in the hand of the executive.
Yeah, but the
What I'm
government
telling
has
you
taken
is,
a
if Guinea-Bissau can do it, what is stopping the Gambia from doing? Condemning and stopping travels from affected countries, closing their border, because we don't want it to come in. Looking at the dynamics of our society, Gambian society, this handshaking issue they're talking about, yes, it is something that is we've been advised to stop, but hardly could you escape the whole day from shaking somebody's hand, because it is our culture, the way we were trained traditional. When you our people, they will even start saying that he's thinking that he's better than us, he's running for.
No, but
some people not understand. No, wait, I'm telling you.
This,
that's why I think
the mentality
cannot change if the advocacy didn't start prior to this. There should be enough civil awareness, civic education on the coronavirus from the day it was announced that they have an outbreak somewhere in the world. These are proactive issues that people should take seriously.
All right.
Prevention is better than cure.
Yeah, but then you had the president.
No, I had the president, but what I'm saying,
that the ministry.
Gentlemen, I'm telling you, I've never had a program on radio where I've had them prior to these issues. Until recently, when it is said, it is confirmed that Senegal have cases. Before that, I've never had anywhere that people were discussing, or there is civic education for the Gambian population to know the dangers of corona, how to contract corona, what are the signs and symptoms of the corona. The people in the farthest village in the country should be able to have access to information concerning corona. Now, if those people out there, they don't know, here we understand. Some people are afraid with what is happening.
We'll come back to that. We'll come back to the sensitization aspect.
Yeah, actually, because he mentioned border closure and news just coming in, intimates that Guinea-Bissau is able to close its border both in sea, air and land. So this is a move. But if you also observe the President Adama Barrow's statement just now, you will spot about two things there.
Yeah.
So it is not instant approach that is being taken, but what the government did is to stop its own people from going out, and that is the senior government officials for that matter. Even though the message is, stopping all those without essential reasons to leave the country. So if you look at that one is also, so the next move that, as we just witnessed from the message, is that no one should be, joining public gatherings. So it is being banned that for people to gather for no reason for nearly 3 weeks. And even at the cabinet, I mean, at the National Assembly, discussion is going on right now. Earlier on today. So the debate, one of the point we spotted is that of Halifa Sallah. Honorable Halifa Sallah believes that border closure might not be the best options, and he had given a lot of reasons. So we just try to go with the video of Halifa Sallah to see what does he believe about, the reason for the leaving of borders like that.
Non-governmental organizations, they must be part of these emergency teams to respond, this emergency response team. And obviously, Honorable Speaker, we need to concentrate on our link with the sub-region, our neighbors, ECOWAS. We must understand all these policies, and therefore they must be linked. We cannot separate what is happening here with what is happening in other places. And if we close our borders without real consultation, and others close their borders without consultation, we'll create islands everywhere, and at the end of the day, we'll suffocate ourselves. We may not die by COVID-19, but we may not even not having food to eat, water to drink. I think it will end up with the same result. So really, this does not require alarm. It does not require taking measures that are not well calculated, and really what is most needed is proper consultation. We talk about washing hands and chemicals. Well, the minister will tell us, because sometimes the chemicals can be more dangerous than the viruses that we talk about. And people tend to use all these chemicals, and many people are dying of all sorts of diseases because of these chemicals we are consuming in our bodies. So we need guidance, and I'm sure the minister will give us that.
If you look at the statement from Halifa, is like closure of border might not be the best reason, because no country would like to be closed over by the other country. But what we can ask maybe gentleman is, you already confirmed that Gambia doesn't have the testing facilities. So suppose we close the border now, where would the test sample be taken to? Who will take them? Who will admit them in their country?
Like I've said, this testing facility is not available in the Gambia. That one is something is pathetic. But in as much as it's not, when you close borders, there are certain exceptions. When it comes to issues like, you are not closing the border for emergency and serious. You are closing the border for people coming in and out as they wish. And like he said, Halifa, ECOWAS should be the body spearheaded this campaign like EU did. And all other sub-regional organizations, they did the same. Even by putting whatever you're thinking at the back of your mind, the most important thing is containment before it spreads. We don't have yet confirmed cases. Now what is our primary objective is containment. And one thing also we fail to understand in this issue is, that's why I said it is very late. It should have been earlier. It is alluded by everybody. Plans should be in place, because like we're talking about right now. The president said in his statement there will be funds, but how much? It is vague. Wait, in emergencies like this, you at least have an amount that you set aside. Even it means that later you will add it, or you will do whatever to make sure to go with the trend of the virus. But at least put something up, like we'll say 5 million. Or $10 million, 20 million for the coronavirus account. You can see that whenever some people contract it, they can be isolated and they can be confined. One, you need gadgets, you need equipment, protective equipment. With even the medical practitioners who are treating people, they need to be protected. But how far have we gone in providing that? One. Secondly, where are the facilities if people are contracted? Where will the patients or the affected people be confined to? These are the issues that critical thinkers should be thinking. And I said civic education, and I will re-echo it. People in this country will take things for granted. Only we hope the God we serve, the God we all believe in, the great God of nation of the Gambia, will get us through this pandemic.
God is for everybody.
No, but it's in our national anthem. That's why I'm repeating it.
Yeah, I know.
Just last week,
great God of nation, to the Gambia, our homeland. Maybe the great God will do us good. As Gambians, we believe in prayers. We keep on praying. But definitely there are certain losses. There are certain things that should be done early.
I know you want I know you want to complete that statement. Sorry for cutting you, but last week the Ministry of Health was here. We asked similar question as to why is the border not closed? Why is it taking time for us to see all these response mechanism in place? So one of the issues they identified was, at least for the meantime, they could only send up checkpoints with medical trained personnel,
of which the president
at the borders as well. So this is the response mechanism for now, because we asked why not the other stages. They said they are approaching the situation according to the magnitude. So if you want to copy the case of maybe Italy, China, it might not be suitable for Gambia.
No, what I'm saying, the magnitude of their preparedness should be very high. What I'm in agreement with, it might be the applicability of whatever fund they have for the gradual stages of where the pandemic is going. But the preparedness should be very high.
Yeah, but then I think
I've passed through these borderlines. I've seen them.
One of the
preparedness they're talking about, the things I see them wearing. Let me tell you something.
The minister have been going
the things
around
I'm seeing them wearing.
Wait.
The things I'm seeing them wearing, you've seen them. Even the pictures on social media. Those are not things that will stop corona. Because this thing you're talking about is like, it's transferred to people like how we get common cold and flu. So the way we are prepared for this, I'm saying.
Can we rephrase the question, because
medical issues like this should not be shown at. When the Gambian government had the outbreak in China, how many months? Nearly we are in the 3rd month. Today should not be the day the government should make a statement on this.
In your view, closing border is very important.
Today should not be that day. When already people are talking people are saying it. It is a rumor anyway.
Probably
people have suspected cases in this country, but they were sent to somewhere else and they proved negative.
No, but if you talk about the government, probably you might have missed it. But then on Sunday, the Minister for Health, convened a press conference to clear the rumor.
Gentleman.
And I think that was
gentleman
a way to start informing the public about the situation of coronavirus in the country.
Gentlemen, when we're talking about government, the state ministers are policy, they implement policies. Policies are made.
Yeah.
But when issues like this happen, we need the CEO of the country.
Then you have to go
you know what?
You need to be specific.
Emergency things, they will call for emergency actions. Issues were treated with so much care. But this one is more of an issue to the Gambian
like
people.
Halifa said, in every move government take, it should be well calculated, and I think that's why.
I think the calculation they're talking about, that should be well calculated. That's why I said, my honorable gentleman in the studio, it is late. If it has been started in late January, even if you started in early February, by the end of February, after 29 days, you would have gathered the necessary information. You would have gathered the necessary expertise. You would have gathered the necessary applications that you should do to contain. You should have done the necessary consultations with your sister countries around the sub-region and the sub-regional bodies to see how best we can contain the spread of this pandemic.
Yeah, if you're talking about lateness, it seems that you are so pessimistic that even right now nothing could be done. As a country, now we move on based on where we are.
Yes.
And one question I am wondering whether I should ask is, already, as you are talking about how late it is, now a message is coming from the president that measure is to be taken now. Whoever lands in the country must be observed, must be quarantined. Yeah. So this, is it not something that maybe we can appreciate a bit?
No, but I said in my statement, you didn't hear me well. I didn't say, I said the statement is so-so. I'm saying it's so-so.
What does it mean?
It's not so bad, it's not so good.
How can you define that?
I will define it in a way that you will understand. I'm saying, it said, at least, it's better late than never.
Yeah.
There is a saying in English, better late than never. But it should have happened prior to what is said today.
Just a quick
I'm telling you,
a quick
this could have been the second one or the third one. Because we've seen head of governments do it for the first, the second, and the third time.
Now,
that's what I'm telling you.
Assuming that president is listening to you right now, assuming that he is going to implement what you are suggesting here, suppose we close the borders tomorrow. What do you think? How much can Gambia resist?
Let me tell you something.
The situation.
Whatever you do when it comes to decisions like during a pandemic, it goes with cost. It goes with
let's break down.
It goes with problems. Right now,
leader of the United Democratic Party.
Right now, yes, I'm saying right now, you've closed open markets. That is Lumos and all other public gardens. They have economic effects. People's livelihood are attached to that for 21 days. What is the government? What package does the government have?
Where are the Lumos?
I'm coming.
Let us just contextualize. When you say Lumos, we have to contextualize, because right now it is the Lumos, not the Lumos are in the rural areas right now. So one aspect of the society in the Gambia is being affected. So now closing borders across country, meaning the entire country.
I'm telling you.
Let's just explain the degree.
My honorable man.
You are the honorable.
I think, no, you are the honorable. I'm telling you, most of the Gambia is affected by that Lumo than any other thing. Let me tell you, rural Gambia, 95%, there are certain villages, they are far and wide in the country, they don't have access to this market. It's only weekly they go to these open markets, these Lumos, to do their weekly shoppings or monthly shoppings. Shops are supplied goods from these open Lumos. How many villages you have in the rural Gambia? Those rural villages, they don't have markets. Maybe Serakunda, Banjul, Tabokoto, Soma, Basse, these big towns and villages will have. But there are other villages, they don't have markets. They rely on these open markets for their socio-economic growth and their livelihood.
Are you suggesting the government should have allowed people to continue gathering in markets?
No. I'm saying it should be restricted with certain, that's why I'm saying the consultation should have started early. That is the time you will know what the rural Gambia is saying about.
No, but all countries take measures to to stop public gatherings
not
and all that.
immediately.
Yeah, but then
no, wait.
I'm taking, when you take France into context,
no, but
they didn't just.
But our neighboring here,
wait,
Senegal, only take decision after they confirmed decision already in
when
the
you
country.
put France or Paris into context, they didn't just get up and say we're gonna close Paris, Central Paris for tourists.
Okay.
They did some investigation. They allowed. They see that tourists are coming, and the problem started with the tourists coming from the affected area. They say without stopping this, it might just increase the number of coronavirus victims in our country. They closed Central Paris. Before even Italy, northern side of Italy was quarantined. They were moving freely, but when they saw the dynamics are changing, they closed. This is what I'm talking about.
Okay.
You have to put structures and mechanisms and measures in place. When the dynamics of those measures are changing with time, the trajectory will change also. That is the side you're going with. But rural Gambia also will be affected with this open lumo closure because it's so immediate without being informed, without being notified.
But we are talking about
notification is very important.
You were talking about the cost.
Yes, I say you go with cost.
Yeah, of course.
Now, if supposedly you do that, what policies or program do the government have to help those people in rural Gambia to have access to food, to market, with certain guidelines and protective equipments or gears, so that even they don't go to open market, they will have access to certain food items that are very important for their livelihood. Like these open lumos, like I've said, there are some of these villages have only the lumos as access to food.
Okay.
Now, when you close the open lumos, how are those people going to get food?
Okay.
Secondly, the amount should be stated clearly that we have this for an emergency fund for COVID-19.
Okay, hold it there for now.
There where we start.
You just have to hold it there for now because we will come back to you.
Actually, one of the gateway to the country is through the international airport.
Exactly.
And today at the National Assembly, parliamentarian asked the Minister of Health, Dr. Samate, about why is it taking too long for the airport to be closed. So he explained some of the reasons why the Gambia is still allowing flights in the country.
With regards to the flights, banning the flights, of course there are international regulations guiding this. As a nation, as a small country, there are quite challenges. But we all know, I mean, if a disease is imported, if any country has the means to do total blockade, probably it will never get to the person's country because it was outside in the first place. So total blockade, that means it will never come. But not many countries have the means to do total blockade. That is even why the West, they have a lot of challenges with all their resources, because there are a lot of considerations. Do we put a dichotomy and say Gambians can come in, but non-Gambians cannot come in? Because it's going to be very difficult for us to say Gambians don't come to Gambia, especially we don't know their social situation there. A Gambian travels, now his time to come back has come. The ticket is expiring. He has no money to stay anywhere, no money for food. He wants to come back, you know, and so these are the challenges. That is why the flight bans have become very difficult. But we are looking at modalities of, even if they come, we keep a close eye on them. When we keep a close eye on them, as soon as they develop symptoms, we test them and we take them direct to treatment. So this is why we are thinking about the quarantine.
That was Dr. Lamin Samade, Minister of Health and Social Welfare, explaining why the borders are still open for flights in the country. So he made mention of a very important point that, you know, if you close the border, you cannot just determine how extensive it is. If you don't go, you may also allow others to in.
Now,
so Gambians abroad now, if they want to come back when the borders are closed, he is raising a concern on that.
Now, what I'm asking, and what is not very clear to people, when he say we observe them, how do they observe them and where?
Observe who?
The people who are quarantined.
Yes.
You know, when you want to quarantine people, you have to confine them to a specific area.
Yeah, and in
for
fact,
a period of 14 days, like you said.
Yeah, that's what the president said.
No, that is what the president is saying today. But the honorable doctor,
this man spoke before the president.
Yeah, he spoke. This is at the National Assembly.
Yeah, exactly.
He said there are some modalities. They will check you and they will observe until such a time that you have something that similar to the symptoms, and you will start treatment. But where do they do that? So, or you just at the airport, they look at you, they think you have symptoms. They start
no, but
or they allow you to go to the house.
The president did say that he was informed, and this was also confirmed by the minister that 355 people were.
What I'm saying,
checked.
I'm not disputing all what you were saying.
Yeah,
I'm saying it is still obscure. It's not clear. Where is the center? Where is the place? In this speech, we have heard it will happen, but where is it?
Yeah, this was a response to the National Assembly.
But I'm saying specifically,
prior to the statement. Just prior to the statement, let me put this in context a bit, because he already mentioned that in 2012, when the Ebola outbreak was announced, there were quarantine centers across the country. So as a result of this is also, all those centers have been reactivated. That is one way. Two, is it not possible when someone comes into Gambia, you have details of the reason why you come, and then you are followed according to the locations you go? What do you think about
I think we are on the same page. We're going like...
Yeah, you sounding like a doctor now, because you want to examine exactly the situation or the stages or steps to be taken. So this is what you want to have. Yes.
I'm concerned. You know why I'm concerned? Some people might come with the virus. They will not have the symptom because they are telling you this coronavirus will spend 4 days in your trachea, that is in the throat, before it will start infecting the lungs. So during that period, you don't even have signs and symptoms of corona. The only thing you feel at times is that you have itching in the throat or in the trachea. You are advised to use warm water with salt and other identify substances that will able to maybe contain the virus within the trachea before it gets to the lungs, and you are asked to consume a lot of water. You know what I'm saying like this? How many people have access to informations like this? How many people understand, even those people there at the quarantine center? Not all quarantine centers have medical experts there 24 hours. Maybe sometimes some people are on duty, they will go home. At times the airport, some flights, when the time they will land, only few people are there to attend to people.
Yeah, but this is a time of emergency.
I know.
No, Nyawuru, you must agree that government would make sure that people would be available for 24/7.
Thank you. That's why I'm saying it should have a special fund, because special emergencies like this, you need extra cars.
But Barrow
you need a special budget.
The
medical budget has already been approved by the National Assembly.
Yeah.
You know, already that is approved. But now this is a pandemic that is coming towards the country, or we're suspecting maybe we should have contingency plans. What is the amounts put aside? What should be, you know, so issues like this, you should be very,
your point is clear. Just we need to ask you again, because
it should be there on time.
Yeah, you came up with a very clear point, but now suppose it is your time now to decide what procedure do you think should be taken, because already from the statement we have seen Barrow pledging that the minister can dispense
he has
funds.
given directive.
So what procedure should follow?
If it is my government,
as president of the country,
president of the republic, I will have assigned the Minister of Finance 2-3 weeks or 2 months ago, after hearing the outbreak of this pandemic.
No, we don't want. Don't take us aback. We are from today thinking of the future.
If I was the president
on this situation no, it's how do we move forward, not backward.
I'm moving forward.
Yes,
I'm not moving backward.
Started from
the
today.
answer of this question have to go back. If I'm the president,
you cannot go
of
forward.
The republic,
you got to go
I
backward.
would have asked the Ministry of Finance 2 months ago or a month ago at least to have an emergency fund, and if necessary table the bill in front of the lawmakers of our country to endorse it, so that it will be readily available and it would have been there in an emergency account.
You are on this table to create
asking me.
No, you know, you are invited with honorably to help bail out the country.
I'm doing.
So, you know, going to the past will never happen again.
No.
So from where we are, how do you...
What should I do when I'm president?
Yeah.
I'm saying, what should I have done? What should have been done? You still...
Okay, I want to reframe this question. Now you've seen the situation in which
I will
we are.
change it the way you want it now.
We are on the situation.
If I was President Barrow today, in my statement I would have said, I would have assigned the Minister of Finance to prepare a budget of 50 million emergency budget. That will be
dialysis.
That will be set aside to contain the coronavirus as of now until when the trajectory changes.
Now, your problem here is not giving the amount.
Yes. You know why? Technocrats, bureaucracy doesn't work like that in a day. It has to go through processes. There are certain amounts before they will be disbursed. It has to go through waste so that it will be available to people who will use it. That will also might take time. It will also might affect the people who should their job immediately. I'm telling you this. I know what I'm telling you.
Yeah, but also again,
if like, unfortunately, may God forbid, somebody comes in, and he's tested positive for corona without the fund being available. What is going to be the next move of the medical sector? We might end up overstretching the available medical supplies that we have there, and that should be there for the population, even without the coronavirus.
There's consolidation fund, whether it is announced for a reason or not. Always government has contingency funds, which is normally could be used. So in that situation should have been, but maybe you want to redirect the...
exactly. I just wanted to little bit...
If the government has one, they should have said we had a contingency of 20 or 30 million for such issues. This is what I'm talking about.
So the secrecy is not helping.
There should not be any secrecy in this. You know, those times have gone. Proactive Gambia needs no secrecy. We need information. Everybody needs to be informed so that they will be at ease. I'm praying to everybody. I'm appealing on behalf of the government and all the Gambian people to keep calm. We are not sending a wrong signal here.
We
want everybody to be calm.
Exactly.
It is not serious like some people are talking about, and people should also stop one thing.
I was coming to
Fanaticism. Whatever happens in this country, before you even have expertise advice from an expertise or expertise view, or you don't even know, you tend to share information. You tend to spread information that will create that pandemonium among society. It's not good. This is Gambia for all of us. There is no time for whatever some people have time for. The one time we have right now is to see the Gambia, to deal with a pandemic that is out there for everybody, regardless of color, tribe, ethnicity, or whatever. This is a serious issue. What I'm advising people, some people are doing that, they are prone of doing that, sending wrong signals, creating that panic in society. No, we are not up to that stage. But what we are saying is, we want people to also understand the government to be proactive in whatever they do. Whatever the funds they have, they should make it open. You know, I'm telling you, whatever you do in this world, it is very important to instill confidence in people. Even people are walking around a thin line. When they know that our government have 50 or 100 million out there for us, when it comes, some people will feel that it's whatever happens, there is an emergency fund.
You are sounding politician, but
no,
just keep this. Just hold. Let us go with
technocrat.
Let us quickly look.
If I'm sounding politician, this is no politics.
It's a whole discussion.
This is Gambia, and I'm part of this country.
And one of the
Corona is for all of us here.
Let me get back to you.
Very serious.
Yes, let me get back to you quickly, because moments ago the Minister of Health engaged GRTS on the same issue we are talking about. Let's find out what he said to GRTS earlier.
The Ministry of Health wishes to update the general public on the current situation of COVID-19 in the Gambia. In this regard, we would like to inform the public of a confirmed case of COVID-19 who is currently in isolation and receiving excellent care at the Medical Research Council Clinic in Fajara. This is different from the 2 suspected cases from Indonesia that were tested to be negative. With this announcement marks the first case of COVID-19 in the Gambia. This particular confirmed case is a lady in her 20s who returned from the UK on Sunday through the Banjul International Airport. A day after arrival, she started to have fever and decided to self-isolate at home. She reported to the MRC under isolation and was tested and found to be positive. The Ministry of Health, in collaboration with the Medical Research Council, have started the process of contact tracing and will endeavor to reach all contacts, especially those in the same flight. The public is hereby informed that all patients who came, all passengers who came with in the same flight or in contact with the confirmed case will be traced and undergo isolation. The team has started looking for all such contacts. The laboratory results for the positive case came after the broadcast of the presidential statement on the government's efforts on the COVID-19 prevention measures. This shows the fluidity of the situation worldwide, with possibility of the situation changing by the minute. This, however, goes to buttress the importance of the measures declared by His Excellency the President. The Ministry of Health encourages the public to continue practicing the following recommendations. 1, hand washing with soap and water. 2, covering the mouth with tissue or the bent elbow when coughing or sneezing. 3, social distancing. 4, call the toll-free number 1025 if in doubt for more information, or contact the nearest health facility. The cooperation of the general public in this endeavor is highly solicited. Thank you very much.
That was the Minister of Health and Social Welfare confirming the first case reported in the Gambia. So as of this information, Gambia is no more COVID-19 free because the first case has been recorded now. And it is coming just a few minutes after the President addressed the nation with the information that Gambia was free of COVID-19. And the results, according to the Minister, came immediately after the President, televised speech was broadcast. And then, gentlemen, we have seen Gambia is now, part of the show.
This is my word. I've said it here and I'm vindicated again. This lady passed through the airport.
From England.
From England. But I told you the symptoms and signs doesn't develop like that. And do you have even having some flu? What are the contingencies? Now we have it. What are the contingencies? You don't even have a fund in place. Now you have a confirmed case. How many people will do that? Some people will say, in Gambia we use the they get into gatherings, they get into people, some people start greed. He contacted virus. I come and contact the contacted. But what is the contingency for issues like this? That's why I'm saying you don't wait until trajectory changes in case it comes like that. Now, if we need emergency funding about 2-3 days, we have 3 or 5 cases. The funding, I'm talking about, like I said, at least if we have $10 million in place or $10 million, you know where to go, tap it directly tomorrow, start other necessary adjustments. Now that means that the modus operandi of the health facilities and the inspectorate teams at the borderlines and the sea and whatever port we have should change. Now it's not any more containment, it's dealing with the coronavirus direct is in the Gambia. So the language should change.
The past 1 hour,
the management should change.
Observe a trend of flow of information from the National Assembly, then come to the President, and now the Minister of Health.
It's conflicting.
I mean, yeah, but the minister.
Let me tell you something. That's why I say the government should be making informed decisions, very informed decisions. These results cannot come overnight. We know medical processes. It cannot just come minutes after when the president.
You want to say the President misled the
No. Oh, the minister is misleading us.
Or the President?
Yes.
The President said it is free.
Yes.
And now minister
less than some minutes.
But minister said immediately after the broadcast they got the results. So results takes process. So
I'm not trying to point fingers here. We are.
No, but that's what the minister said. We just have to.
What I'm saying is it will baffle me. Today I told you there are rumors that different from those 2 Lebanese. Since during 11/12, I myself heard that a lady from UK, it is in the internet, how many hours ago, that a lady from UK has already contracted corona and it's a confirmed case.
It's tested.
It was tested. It was in the internet how many hours before the president made his address to the nation? People should not have skipped those things. The technocrats and the bureaucrats should not have skipped that thing.
So for you,
because I know people, everybody should be
in better position to
the minister should be in a better position
to announce,
to inform the president that we have a confirmed case. Even if we don't have it confirmed, he should have informed him prior to, before he made his statement, that different from the other two that proved negative, we have a new suspected case.
Why do you?
And he's going through tests so that it will be embedded in his speech. But the president cannot say this, an authority, a policy.
Why do you think
and the next minute
the president will know this and then will not say it to the public in such an important message that
no,
he
I'm not
delivered?
saying he
why,
knew it.
Just why do you think?
I'm not saying he knew it. I'm saying then people who are responsible for informing the president are not doing what they're supposed to do.
Like the minister.
Yes, and the other technocrats who surround him.
Why?
Because let me tell you something. Issues like this are very serious. Even before he makes his speech, you should have told him we have an additional case who is undergoing tests, and maybe by the time you finish your statement, he would have been confirmed whether it's negative or positive. He should have embedded that in his speech, that we have two negative prior, but there is still somebody who traveled from UK. He's at the Medical Research Council. He's been tested, but whether it will prove negative or positive, we don't know yet. But we don't want anybody to send any alarm or panic statement anywhere so that people will think that it is out of context. But now, right now, all over people are watching. Gambia is no longer free from coronavirus. Now the dynamics of the checkings has to change. The GS, this is what I'm telling you. Look at what the preparedness at the sea and the airport and even at the borderline land borders. It has to change. Now,
some point in
it
time,
has to change.
You know, one of the politicians argued that, you know, it is easier normally to criticize. But let's look a bit into what the government is doing and looking at the lack of resources in place at the Ministry of Health. So today they said they have, you know, actually reactivated all the centers where they can isolate people, and also about 355 people have been followed and their situation is being confirmed. And now, you know, today, in fact, the whole day, we were preoccupied with reporting of the 2 Indonesians who allegedly come into the country to definitely to run away from the virus somewhere. They were isolated, tested, and then proven negative. Now, it is the lady from the United Kingdom. So I think a lot of effort is being made by the Ministry of Health, in your view, right?
No. They've tried. But I'm telling you, this is what I'm talking about. And you're still coming back.
Just before you go today, you know, earlier today, we will discuss what your party leader, the United Democratic Party, said today. He spent a lot of time commending the Ministry of Health. So, but you seem to be sounding a little bit different. I don't want to make it political.
I want everybody to understand this. This is not a political issue.
Okay.
This is a sensitive national issue. I have my take. I have my views, and they should be respected. I'm not saying what they've said to allude to somebody's effort. What the party leader does, that at least there is an effort from the minister. And they've started it long time ago. But the way that it should be given by the government and the head of the government. Whatever you do, your leader has to support you. That is what he is saying. But what I'm telling you is, we are all going back to what I've said earlier. I said, that's why I asked, what is the containment method? Whether if somebody is suspected of having symptoms, will be allowed to get to his or her own house, and later he will be monitored. And how is the monitoring going to be done? If he has corona, that is the time they start treatment. And this is what is proven today. The lady came, passed them, did the normal screening, and they were there. She was allowed to go to her house. It's because of the lady quarantined herself. That's why the Medical Research Council ought to know that she has corona. If she has not done that, maybe by the time still now we're talking, she would have been in her house transmitting the virus to other people or spreading the virus. This is what I'm talking about. What if you say you want to quarantine people from the airport?
I think you
have to take them to a confined location or a specific area. That they will be observed, they will be checked, they will have certain tested. When they prove negative, you allow them to go. When they don't, you start treatment there. This is what I'm talking about.
So they need to be
when you say quarantine, it doesn't just stop at the word quarantine or these are the methods that are in place. The facilities have to be there. Physical facilities have to be there. Those centers you're talking about, that is the time they should be using those centers. If they have visual medical facility, they are out there for that. When somebody comes from UK and affected area, grab him, take them there for 2 weeks, check them, have tests, confirm their cases and their status. If they are negative, allow them to go to their family. If they are not, give them due treatment. Okay. Is this what I was not talking about? You see now what I'm talking about? I didn't say they didn't put measures.
So
but the measures should be specific. It should be descriptive and it should be very organized, well drilled, well oiled.
Let us just go back to what the president said some minutes ago. He said, he said, as another preventive measure, all travelers from hotspot countries will be isolated for 14 days upon arrival in the Gambia. So this suggests that there is a definition of the process, because they will be isolated, not that they will be left to go. Maybe, probably this lady, when she was coming into the Gambia, this message was yet to, but now it's an
so
order by the
you will
president.
still accept that I said it's you will also accept that I said it's late.
It's late, but if it is late now,
no,
how
wait.
do we
What I'm saying is, honorable men, I want us to be in conformity here. I want us to be one here.
Yeah.
We are not saying what the government said is not good, or the measures they've taken is not good. But the timing of the message is late. If this have been done 2 weeks or 3 weeks ago, this lady would have been in a confined, isolated area by now. Okay. This thing was spreading out. People are saying this serious. The government need to take serious issues seriously. This is what I'm advocating for. Let the government of the Gambia take matters of national interest seriously.
Just in your view now, Senegal, more than 20 cases confirmed, and today, just this evening, 1 case confirmed in the Gambia. Where does this put Gambia in the world map now?
Where it put us is in the corona list of countries affected. Secondly, what we need to do is what Senegal is doing. We need to have facilities. We need to have equipments that will be even helping the medical practitioners and the people, the nurses, the doctors, to do their job in an environment that is conducive to contain this. We have one. It's easier right now. Like they said, they should go to the manifest of the flight that this lady here and start following those people and start taking them, confine them to an isolation area to check whether they have the coronavirus.
Okay, now I just wanted to come on now, because I think hence finally it has been confirmed, you know, like he said, Gambia is on the list of countries that are really in the list of coronavirus. Now let's talk to the Gambians. There were some anxiety prior to the confirmation of, you know, the COVID-19 in the Gambia. People were a little bit worried when it was confirmed in Senegal, and all that. There was a whole lot of rumors on the social media. Now, how do you think Gambians would welcome this message now? There's COVID-19 or coronavirus in the Gambia.
It is a situation that we are beginning to realize, because even our guest Nyawuru is believing to is saying that he is vindicated. So you know that means it is not new. So the social media has been making its own rounds. So they don't wait for any verified information. Once they see, you know, pictures and unconfirmed footages, unconfirmed pictures, and then messages are going from morning to evening. So this has been going on, and then now that the president speaking, few minutes after that, you know, for the minister to come and confirm a case. So it's like, what was the president doing? How come he was
those
aware of this?
positions have to change now in terms of communication, especially, you know, on the social media, and the media as well, because I believe Gambians now need to be more responsible, because recently in Senegal we have seen people that have been called for questioning regards giving information about this disease.
No,
I think that's very serious.
I think it's funny because we have to take social media seriously.
Yeah, but what I'm saying also,
no, I am saying we have to take social media seriously.
How serious should we take it?
Because 98% of the rumors that you normally say on social media, including people's positions, people's being changed from ministerial, people being fired, people getting this, people having some scandals around, end up being the truth.
Yeah,
in the country here in the Gambia,
but
we have the tendency of 98% of the rumors that are aired or they are written in the social media.
In as much as
it's not, it's fact.
Yeah, in as much as people, you know, have their right or whatever.
It's fact. I can give you a list,
and
on endless list here, and it will all happen.
But also, a lot of things reported on social media, proven, you know, wrong.
That's why I'm telling you, we have to take it seriously in the sense that we have a media team at the State House. Issues like this, when you hear a rumor, you don't just sit on it. You at least do your own investigation.
Yeah, but that
call the Medical Research Council, ask whether they have any other case from UK different from the two Indonesians.
No.
Ascertain it, provide. You know, governments need to be having informed decisions. They don't need to work on rumors like us.
No, but excuse me, I want us to put the record straight. I was just giving an example, you know, from what happened in Senegal. At some point, there were people who were given, you know, irrelevant information with regards to the disease. At some point, people were downplaying, you know, the severeness of the disease and all that. So I think people need to be responsible also in giving out information.
But I said that here earlier.
Yeah, but this
I
is
said Gambian people need to be responsible.
in
as much as you want to criticize, or in as much as you are worried about the state of affairs and what this coronavirus might bring to the country, you should also be very responsible, not to propagate panic.
Yeah, exactly. That's very
just play it out of context. Take it to the magnitude where it is not. We've just confirmed a case. Senegal have confirmed 21 cases how many weeks ago?
Yeah.
They're still managing. People are going on with their livelihood, but have been very careful of what they do, are conscious. That is what the government needs now. They need to be conscious. They need to take their personal hygiene seriously. They need to avoid coming in contact with other. Too much of this handshaking. People need to tell each other, not that you belittle somebody because it's our norm. The mentality has to change with time because of what is around. We have to control our kids. We also have to make sure we have like sanitary equipments, liquids and all over in public places where people meet, so that people will be washing their hands, doing the basics of basic hygiene properly. And we should avoid coming in contact with people from areas affected. When you have an individual, even a family member who comes from an affected area, report the issue to the nearest health facility.
And this is again a national issue. You know, it's time that everybody says Gambia.
It's time everybody become Gambian. Yeah, we are not representing any color. Yeah. The color we should all represent is the blue. It's the red, white, blue, white, green.
Yeah.
That is the Gambia.
Yeah. The flag.
The flag. The Gambia, our homeland. That is what everybody should be representing now. Now we have a task that needs a Gambian effort. Now we have an issue that needs a Gambian zeal. Now we have a virus that needs the Gambian mindset.
Gambianness.
What we need is the oneness, and let us put this coronavirus of our country. Let us wash it off our streets. Let us wash it off people. Even the people who are suspected, let us support them morally, psychologically, so that we can overcome. That is the only thing we need. Stick together. Love your brother and be your brother's keeper. Always advise each other on personal hygiene. Yeah. Always take responsibility of not doing things that will propagate the spread of the virus.
Exactly. I think that's a very good message and a strong one indeed. Press, I was also ask you about we have been talking about the position and issue of government here, but of course the opposition also. We have seen today UDP leader came out and of course shown solidarity and called for national efforts in fighting this disease, and I think we expect this from other political leaders and also individual Gambians, the philanthropists, those that have the means to support or stand by government to come forward and do so.
Yeah. Then we go with Dabo's insert today, earlier on the press conference that he held at his secretariat.
Well, I'm not too sure whether we are as properly equipped as other countries. That is why I'm making the appeal to the government to have an assessment of our health infrastructures, on our preparedness, on our ability to handle the situation. I am sure there is the will. I'm sure there is the will to really contain this pandemic. What I'm not too sure of is whether, we have the wherewithal. I've not read the story, but I see that one of the headlines, I think in the Standard, that $60 billion is received to help the government's economy on the virus. I've not yet read the story, because sometimes the headline doesn't match, the stories don't match the headlines. So, but then there is that, yes.
My final question. Yesterday, the Minister of Finance have said that the country will at least lose nothing less than $1 billion, which from revenue, which one will believe that it is going to. As someone who have been in such high, do you advise the
Well, I would advise that there be a proper assessment, because that's what we have said, that we want to assess the impact. We want to have a proper assessment, because the minister, but then maybe that is why I'm saying that, look, let us get consultations, because if your source no longer import from your source, and what you have here, you want to make profit out of it by exporting it. I think so. These are some of the measures that the government should put in place. Have consultations with the business community, that whatever stock